Hello world, welcome to Simply Simplified Health. I'm your average Joe, and today we're going to talk about the virus that has been causing our current pandemic, Covid-19. You see, Covid-19 is a virus that belongs to the coronavirus family, which is a large family of viruses that usually cause mid to moderate upper respiratory tract illnesses, similar to the common cold. Within the past 2 decades, we have seen 3 major coronaviruses that can cause more serious and even fatal diseases. The first one we saw was SARS coronavirus, which emerged in November 2002. The virus, however, disappeared by 2004. The second virus was the Middle East Respiratory Syndrome, also known as MERS coronavirus. From what we understand, this virus was transmitted from animals to humans. It was identified in September 2012 and continues to cause localized outbreaks. The third virus is coronavirus disease 2019, also known as COVID-19. Which emerged from China in December 2019 and was declared a global pandemic by the World Health Organization on March 11, 2020. We have treatments for SARS, MERS, and other coronaviruses. However, COVID-19 has posed to be slightly more difficult when it comes to creating a vaccine. COVID-19 has a wide range of symptoms, and these can be anything from mild symptoms to severe illnesses. These symptoms or illnesses can appear anywhere from 2 to 14 days after being exposed to the virus. Just because you have some of the symptoms does not mean you have COVID-19. However, if you do have them, you should at least get tested. The symptoms that have been given to us by the CDC are fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. There are some symptoms that are much more severe. If you have any of these symptoms, you must seek emergency medical care immediately. These emergency symptoms are trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and/or bluish lips or face. As you may have noticed, COVID-19 and the flu have both very similar symptoms and are both contagious respiratory illnesses. However, these are very different viruses, and whereas the flu we have a vaccine for protection against, COVID-19 does not currently have a vaccine as of this video. The best protection from COVID-19 is to avoid being exposed to the virus in the first place. This would be a collective effort from many different people, meaning people who have the virus should self-quarantine themselves. People who don't have the virus or have not gotten tested should always wear a mask when in a public setting and try to stay at least 6 feet apart. If you are infected with COVID-19, the best thing you can do is to stay at home unless you need emergency medical care. Make sure to keep taking care of yourself by staying hydrated and eating correctly. Keep in contact with your doctor and get their advice on how you should care for yourself. If you have any trouble breathing or have any emergency symptoms, make sure you get checked out by a doctor immediately. Do not take any public transportation, whether that be Uber, taxis, buses, or any other kind of public transportation. It is best to separate yourself from people to avoid infecting others. If you live with a family or other people and have contracted COVID-19, try to separate yourself by a room. If possible, you should also use a separate bathroom. If you do need to be around other people or animals or outside the home, make sure you wear a mask to protect others, as well as yourself from getting sicker. Over-the-counter medicine has shown to alleviate symptoms, but don't take this for a cure, as you are still contagious if you have COVID-19. Even if you yourself do not have COVID-19 or none of the symptoms, but you have been in contact with someone who has or who might have been exposed, you should quarantine yourself and get tested immediately just to be sure. This virus has killed many people, whether it be from the virus directly or complications due to the virus. I myself have lost family. Only together can we make sure everyone is educated on the virus, knows how to protect themselves and other people, and work together to get through this shaky time in history. There have been outbreaks in the past, and humans have always come out on top in the end. Every individual is strong enough to get through this time, and we have the technology so that even when we're separated, we can be close to each other. If you have any questions about COVID-19 or any other health-related questions, while I am not a doctor, I will do my best to answer any questions. Don't forget to like and share the video, subscribe, and hit the little bell for notifications on new videos. I'm your average Joe, and thank you for staying healthy with me today.